In this segment, you'll learn about the two main types of pain medication used in labor, analgesics and epidural anesthesia.
Breathe.
Janine's labor started yesterday afternoon. She labored at home for several hours before it was time to go to the hospital. It's now early morning and she is exhausted and considers pain medication. She requests an analgesic, which is a medication that affects the whole body. It dulls pain sensations, but does not get rid of the pain completely. The analgesic is either injected as a shot in the thigh or buttocks, or given through an IV line.
You probably have just enough time to have one dose of some medication in your IV. That will just take the edge off. So it's your choice as far as what you want to do.
So the reason why I was open to the IV drug is because the doctor had said that it was a way to kind of take off the edge. And I needed to take off the edge. And I felt like my breathing was doing pretty good, but it was just so painful.
So after Janine took the IV drug, I experienced her as more calm, more collected. Even though she was still in pain, she wasn't as stressed. So I noticed a difference.
If you decide to use pain medication, there are benefits to choosing an analgesic. You can receive it shortly after you request it, since it doesn't require an anesthesiologist. It offers pain relief immediately and does not numb your muscles, so you can move around after it wears off and push more effectively. However, analgesics also have some risks. They may make you feel drowsy or disoriented, which limits how much you can move around while they are in your system. They can also cause nausea and itching, requiring additional medication. An analgesic may slow down your breathing and lower your blood pressure. This is then treated with IV fluids and oxygen. Another thing to consider is that there are some risks to the baby. Analgesics enter the baby's bloodstream through the umbilical cord. This may cause slow or shallow breathing in the baby after birth. In this case, doctors might give him additional treatment and observe him more closely. Your baby might also be sleepy and less alert at birth, making breastfeeding more difficult. It's recommended that you consider analgesics earlier in your labor in order to reduce these effects on the newborn. For this reason, many hospitals have policies regarding when they allow you to receive analgesics during labor. For Janine, the analgesic wears off and she progresses into pushing and birth several hours later.
Good job. He's coming. He's coming out. He's out. Okay. His head's out.
Look down. Look down. Your eyes open. Your eyes open. Your eyes.
Look at him. Look at him.
There you go.
Good job.
When the baby came out, it was a relief. I'm like, okay, yes, it's done. We did it.
Oh, yeah.
You know, I wanted to look at him. I wanted to touch him. I wanted to hold him and see if he was okay.
Another effective pain relief option to consider is epidural anesthesia. As you follow Marimar's birth story, you'll learn more about epidurals. She went into labor about 8 hours ago. Now she is dilated to 5 centimeters and requests an epidural.
The reason we chose to get the epidural was just really the exhaustion that I felt, that I had been up the night before with contractions. So I was really tired and I was unable to sleep through them. And we just wanted to make sure that I would be alert and that I would have the strength to, push when it came time to push.
Marimar receives fluids through an IV before getting the epidural. The procedure is performed by an anesthesiologist or a nurse anesthetist and takes about 15 minutes to complete. To start, the anesthesiologist washes Marimar's back with an antiseptic cleanser. Then he injects a numbing medication into her lower back so she doesn't feel the epidural needle.
When they put in the epidural, it wasn't very painful. So I was experiencing some pretty painful contractions. And it wasn't more painful than the contractions.
During the administration of the epidural, I was tasked with sort of staying as a focal point for Marimar, and I was just keeping her focused on, the benefits of what we were doing and why we were doing it, and keeping her excited instead of worried.
This animation shows where the epidural is placed. You can see that the injection site is below the spinal cord, so there is almost no risk of the needle puncturing the cord during the procedure. This image shows you a closer view of the administration area. The center column is the sac that contains the spinal cord and spinal fluid. The gray area that surrounds it is the epidural space. To get into position, you will curl forward or hug a pillow to make more space between your vertebrae, which are the bones of your spine. The epidural needle is carefully placed between the two vertebrae and into the epidural space. A catheter, which is a thin plastic tube, is threaded through the needle. The needle is removed, leaving the tube in place. The anesthesiologist then injects a test dose of medication through the catheter. The catheter is taped to Marimar's back, and medicine flows through the catheter. It takes about 15 minutes to feel pain relief. Once the epidural is in place, pain should be reduced by numbing your belly, lower back, and vaginal area. You may still feel a slight amount of pain, pressure with contractions, or pressure on the pelvic floor as your baby moves down. However, your baby won't feel any numbing from the medicine.
And afterwards, the contractions were pretty much back to how it was at the beginning. So I was able to get some rest after that.
Having an epidural brings about an immediate increase in using more medical equipment during your labor. You're continually monitored after receiving an epidural. In addition to fetal monitoring, the staff monitors your blood pressure and the amount of oxygen in your blood for the remainder of your labor. Since your legs might also feel numb, and you may not feel when your bladder is full, you'll need a urinary catheter. This is a flexible tube used to drain urine from your bladder. One downside to having an epidural is being stuck in bed and not being able to use more productive upright labor positions. But with the epidural in place, you can still move from side to side once in a while. Changing positions helps your baby rotate into position for birth. Partners and support people. After the epidural has taken effect, mom still needs your emotional support, so stay close and provide words of encouragement. If she falls asleep, you should also take the opportunity to rest. There are several benefits to having an epidural. It offers very effective and safe pain relief. And it also gives you a chance to rest, which is welcome if you're having a long or difficult labor. Also, the medicine in the epidural does not affect your mental state, so you can stay awake and alert. Unlike an analgesic, the epidural has little known effects on the baby. The most common risks of epidural anesthesia can include shivering, fever, itching, and nausea. You could also experience low blood pressure, which may cause the baby's heart rate to drop as well, but is usually corrected by giving the mother extra oxygen, fluids, or changing her position. For some women, the epidural does not block all the pain. Very rare but serious medical risks are possible with epidurals and are listed on the consent form. Take note. Since having an epidural can sometimes affect labor progress, it's generally recommended to wait until you're having regular contractions that are opening your cervix. Once you are fully dilated, it's best to hold off on pushing until your healthcare provider can feel your baby's head in the birth canal.